Hi everyone, we're Group 3 and our presentation is about homelessness and food insecurity among young adults ages 18 through 29. The learning objectives that will be covered within this presentation are 1. The audience will be able to identify what it means to be homeless, as well as the different levels of food insecurity. 2. The audience will be able to list a minimum of 2 issues about why homelessness and food insecurities can be present within an individual or within a group. 3. The audience will be able to identify 3 elements about the health outcomes of homelessness. 4. The audience will be able to identify a minimum of 2 interventions that can help with homelessness and/or food insecurities. And 5. The audience will be able to list behaviors, skills, and attitudes needed when it comes to working with the homeless and food insecure. According to developmental psychology, emerging adulthood is said to be a life stage at ages 18 through 29. A recent cultural change that has occurred is that individuals are finding stable jobs, getting married, and becoming parents during their young adult stage, much earlier than it has been in the past. Though at the same time, this age group suffers from instability in their life as constant changes with their jobs or relationships may potentially occur. These changes may also have an effect on their ability to maintain a consistent access to food or proper housing. Some key definitions that should be noted are homeless and food insecurity. The word homeless refers to people living on the streets or other places that are not intended for human habitation. It can also refer to individuals who live in shelters and are lacking a fixed, regular, and adequate nighttime residence. It can also mean that they are temporarily living with friends, relatives, or even others who may be at risk for homelessness. Food insecurity refers to a lack of consistent access to enough food for an active, healthy life. What causes homelessness? There is a huge gap between income and increasing housing costs, which results in many Americans becoming homeless. Currently, over 8 million extremely low-income households put at least half of their income towards housing. Low-income households are mainly those who are unemployed or underemployed. The reason as to why many individuals don't have jobs or have low-paying jobs is because the labor market is challenging. Some individuals may have limited education, a criminal record, unreliable transportation, poor health, or a disability. Others may be employed, but their wages may simply just not be high enough to support the expensive housing costs. Health problems like disabled conditions and poor mental health can also lead to being homeless and food insecure. Over 20% of the homeless population is reported in having a mental illness, and 16% of conditions are due to substance abuse. Lastly, another main reason as to why many individuals become homeless is to escape domestic violence. Leaving abusive relationships mostly affects single adults and families. Survivors of domestic violence usually seek help at homeless services or programs in order to find a temporary place to stay after leaving an abusive relationship. These individuals usually do not have economic resources to maintain housing on their own. In the United States, there are over 552,830 people who are currently homeless. That is every 17 out of 10,000 people. 67% are single individuals, 33% are homeless families with children, 7% are veterans, 7% are under the age of 25 with no families, and 18% are chronically homeless, meaning they've experienced being homeless for at least a year or continue to experience it repeatedly. Over 10,000 individuals who are homeless have HIV or AIDS. Some of the many problems that cause individuals to become homeless are poor health, limited access to health care, a difficulty in obtaining a constant supply of food, the desire to stay safe and away from violence, and stress. There are many health issues that may result from being homeless. Lung complications such as bronchitis, pneumonia, and tuberculosis are common because of crowded shelters with shared breathing spaces, which increase the spread of transmission. Dependence on drugs and alcohol may also occur to those within the homeless population as a coping mechanism. Those who are homeless are also at higher risk of rape, wounds, skin infections, or malnutrition. There are 4 different ranges of food security. Having a high food security means that individuals in the household have no issues and usually do not have to worry about access to food. With a marginal food security, it may be difficult for the household to obtain adequate food at some times, but the quality and quantity of the food is not affected in any way. Households with low food security do not usually obtain the types of food that are healthy for their diet. Quality and variety may be affected, but they are still able to get the same amount of food to the table. Having a very low food security means that it may be very difficult for one or more members of the household to obtain food they need to stay healthy. This may be due to financial or other underlying issues. Those with low food security and very low food security are known as food insecure, which may result in health risks such as diabetes, heart disease, and cancer. Working for a particular health program related to the homeless and food insecure requires several behaviors, attitudes, and skills in order to effectively interact with the target population. Some of the major skills needed are effective communication, organization, and being able to work as a team. Maintaining a kind, respectful, and positive attitude is essential as everyone is struggling in their own way. As most homeless individuals are uneducated or have a lower education level than others, it is important that they are able to understand what is going on while volunteers or employees make efforts to assist them and tend to their needs. Because of this, workers need to be able to speak in a simplified language. Homeless individuals may also tend to be more aggressive, so it is important to be active, alert, and cautious at all times. With homeless people being low to no income individuals, workers also need to know how to interact with them while keeping this in mind and know how to help them while being neutral and sincere. Within the disadvantaged population, homeless individuals would seem especially vulnerable to hunger. As the poorest of the poor, they are less likely to be able to afford food. Their tenuous economic circumstances also reduce access to overnight accommodations that have kitchen facilities for preparing meals or preserving perishable items. Due to limited education, the homeless may be relatively uninformed about nutritional matters and a variety of personal problems such as mental illness or substance abuse, which can hinder their efforts to get enough to eat. As is the case for all marginalized and excluded youth, health disparities experienced by youth experiencing homelessness, or YEH, are determined not only by their individual behaviors, but also by their social determinants of health, which include shelter, educational opportunities, living and working conditions, medical care, local and federal laws and policies, and other social factors that influence health. Youth who lack adequate access to these determinants suffer poorer health than those who have adequate access. Food security has been identified as a key need for youth interventions for several reasons. Youth who are still growing and maturing have significant nutritional needs, and food-related behaviors are largely adopted during adolescence. Such behaviors persist throughout the life course, and they are significant determinants of health. There are many concerns when speaking on the health issues of homelessness and food insecurity among young adults. When young adults are faced with food insecurities, this can lead to a deterioration of their mental and physical health. The rate of young adults struggling with homelessness is increasing day by day, and this can be concerning in the way that these individuals will most likely experience trauma, health problems, mental health issues, and have a high chance of becoming victims of sex trafficking. No individual should have to worry about whether they will eat a meal that day or the next. However, many young adults face that dilemma practically every day. Homelessness can have an enormous effect on young adults, especially when it comes to STDs, STIs, and suicide attempts. It has been shown that rates have increased over time within this population. Therefore, we can now see that the mental and physical health of a young adult is put on the line if they were to encounter food insecurities and homelessness at some point throughout their lifetime. A program that helps young people with food insecurities is a Supplemental Nutrition Assistance Program. This government-funded program provides aid to low-income adults by giving them the budget they need to purchase groceries. Research has shown that the Supplemental Nutrition Assistance Program reduces poverty for millions, improves food security, and is linked with improved health. Much of the program's success is due to the fact that the benefits are available to anyone that meets the program's eligibility rules, which enables them to respond quickly and effectively when the need increases, such as during an economic downturn. Research also shows a correlation between food insecurity and health problems throughout different stages of life, which contribute to the fact that food security is a health priority. Food insecurity is linked to poor quality diet, chronic health conditions, and overall poorer health. Emerging research shows that the Supplemental Nutrition Assistance Program is linked with improved health. Adults receiving aid from the program have more positive self-assessments of their health status. They also miss fewer days of work because of illness, make fewer doctor's appointments, and have a reduced likelihood of demonstrating psychological distress. Another example of a program that helps young adults with food insecurity can also be found on the Long Beach State campus. The ASI Beach Pantry operates as the official food pantry for CSULB students. The pantry offers non-perishable food items for students in need. To gain access to the food pantry program, students must be currently enrolled in the school and be prepared to show a school ID. In order to reach a well-balanced diet, ASI recommends to take an assortment of items. The last program is the Pathways to Independence. This is a government-funded program which aims to help chronically homeless people find housing support and employment. The Pathways to Independence was created to provide comprehensive, person-centered services to help people exit chronic homelessness and become engaged in mental health and mental services. The program aimed at increasing their incomes by helping them find employment and, if needed, gain disability benefits. By fostering economic independence, the person is then able to expand their housing options by increasing access to the mainstream housing market. The program has also helped people gain access to permanent supportive housing so that it is not difficult to obtain and keep their house. The program also found that participants also had reduced frequency of depression and anxiety and were less bothered by their mental health. That concludes our presentation. Thank you.